What are the long-term effects of taking rifaximin? Have you ever wondered what happens when you take rifaximin for a long time? This antibiotic is often used to help manage symptoms of irritable bowel syndrome, especially when diarrhea is a major concern. It can also be helpful for conditions like colitis. Let's break down what we know about the long-term effects of this medication. Rifaximin works primarily in the gut and is absorbed very little into the bloodstream. This means it usually has fewer side effects compared to other antibiotics. Many people notice relief from symptoms like bloating, abdominal pain, and diarrhea for about 10 to 12 weeks after a typical course of treatment, which lasts between 10 to 14 days. However, this relief is often temporary, and symptoms may return after a while. One interesting aspect of rifaximin is its effect on the gut microbiome. It can help reduce bacterial overgrowth, which is thought to contribute to irritable bowel syndrome symptoms. However, studies indicate that the overall diversity of gut bacteria does not change much in the long run after treatment. This suggests that while rifaximin can help, its impact on gut health may not last. When symptoms come back after initial improvement, some patients may consider retreatment with rifaximin. However, research shows that this may not be more effective than taking a placebo. This means that repeated courses of rifaximin might not provide the sustained relief some people hope for. In terms of safety, rifaximin is generally well tolerated. Side effects are usually mild and can include diarrhea, nausea, loss of taste, or nasal irritation. Serious long-term safety concerns have not been identified, which is reassuring for those considering this treatment. Another benefit of rifaximin is its lower risk of contributing to antibiotic resistance. Since it targets bacteria locally in the gut, it tends to have less impact on the overall bacterial populations in the body. This is particularly important for individuals with sensitive stomachs or colitis, as it may make rifaximin a safer choice compared to broader-spectrum antibiotics. For those dealing with sensitive stomach irritable bowel syndrome or colitis, rifaximin can offer meaningful short-term relief from bothersome symptoms. However, it is not a permanent solution, and the return of symptoms is common. Patients and healthcare providers often discuss the benefits of symptom control against the need for repeated treatments, keeping an eye on any changes in gut health or symptoms over time.